Hi, my name's Ellie. I'm just on the way to work. I'm just
I'll give it a one odd minute and then we'll start off.
Where's the vacuum cleaner?
Okay, so what we'll do is we'll make a start and let the others join as they join. We're going to be looking at starting a new unit today, which is going to be health and social care sector. So just for the benefit of everyone who's joining today, we are looking at starting a new unit, which is health and social care sector. This is going to be the second unit with regards to the health and social care course that we're following. And what we'll do is we'll start off with a video just to give you a bit of a background in terms of what does the health and social care sector in the UK look like. So let's start off with the video, and I hope in the meanwhile others will be able to join. Just a few housekeeping tips with regards to the session and your attendance. Just make sure that you're muted your microphone if you're not asking any questions. This is to just reduce background noise and also to ensure that the recorded session for the ones which are not able to join today, there will be minimum disturbance, and obviously the lesson is going to be crisp and clear. When you need to ask questions, feel free to unmute your microphone. You can ask that through the chat route as well. And I can, stop me wherever you think you need to ask any questions, and we'll discuss that as we go along. Just making sure that we are conscious of the fact that we are looking at starting this second unit and the submission of assignment for the previous unit, which is person-centered approach that we have completed. For those of you who haven't submitted it so far, we are looking at the 5th of September as a date, for the submission of the assignment for that. So just keep that in mind. And obviously, as we study the second unit, if you have any questions or if you need any particular details with regards to, what has been covered, they're all on the YouTube channel. And you can also email us on litc@ukversity.co.uk. So I've got a fair few learners which have already joined right now. I'm just going to mute some of the microphones just to make sure that there is no background noise. And I'm going to press record. And we're going to start the discussion. And, obviously, this particular unit, which is going to be the health and social care sector. So what you see on the screen right now is nothing. I'm going to place the press button for record and then look at sharing with you a screen wherein we're going to start off the discussion on this particular unit with a brief video, which is to explain what is the health and social care sector. Obviously, the video is named as Start a Career in NHS, but because in the UK, most of the things that we see within the health and social care sector revolves around the National Health Service. It'll give you a bit of a perspective in terms of, what we are looking at from a point of view of, reading into this unit, the background, also to understand how people, work within when they choose a health and social care job, what kind of jobs they can get, what kind of careers can they, carve out when they work within this sector, and also to look at basic bits in terms of it's not just doctors and nurses that we get to, that we get to hear when we talk about, health and social care sector. It is lots of different types of careers and professionals which work here. And that is what we need to be able to look at when we talk about, health and social care sector. So let's look at this video for a minute. Let me switch you over to the browser and we'll quickly watch this short video, which basically gives us a bit of an understanding on, what is health and social care sector in the UK. So make sure that you are muting your microphones if you're not asking any questions, and ensuring that, there is no background noise. So this particular video is something which I'm playing from the Princess Trust. And when I click on this, it'll play on the YouTube. So I hope you should be able to see, the screen. And also at the same time, what we are looking at is just watching this short video to give us an idea or a brief overview of what is health and social care sector in the UK.
Hi, my name's Ellie. I'm just on the way to work. I work in the haematology lab at Salford Royal. So when I was in school, I always wanted to do I always wanted to be a scientist. So when I left school and I had a baby and everything, I thought I need to do this. So I found the Princess Trust course, and then I didn't even realise the amount of opportunities we actually had. when applying for an NHS job, it normally does tell you what qualifications you need, and some are more than GCSEs and some are not just GCSEs. However, they look more towards experience in the job, and the Princess Trust course does offer the experience, which then means that you could get your foot in the door. It is a scary thing coming into a new job, and when I walked in, it was a bit overwhelming. I could honestly say they were so supportive, everyone around me, and everyone's been in that position, so they all know how you feel. And everyone was just really welcoming. I definitely feel challenged in the job because some days I'm like, oh my God, what is this? It's amazing because the challenge makes you want to come to work. And I find working for the NHS very inspiring as you're helping people who need it the most vulnerable people, poorer people. And it's just, for me, it does fill me with like happiness because you know that you're making someone else's life better. So after a few years, I'll hopefully become a biomedical scientist.
And that's what we want to do.
Yeah, definitely. For me personally, this is my life with the NHS now. I don't plan on moving anywhere. I'm staying in this job and I'm going to prosper and it's going to become my life.
So this was just a bit of an idea to give you what we mean by health and social care sector. So obviously most of the video was actually focused on, the National Health Service. But when I talk about, the health and social care sector in general, we are looking at lots of different types of careers which people can get into. And this is one of the core units that you're going to be looking at studying when we talk about, health and social care sector. So this particular unit that we talk about, will be looking at people who work within social care. And when I look at people working within social care, these include, people which are essentially working with children. They are essentially, looking at working with somebody in the community in terms of receiving care. They're also looking at, providing counseling. There are people who are basically involved in fostering and, adoption. There are people who are involved in social housing. There are people who typically work within the sector and, provide, I would say, services to patients or people who are receiving some sort of therapy. There are people who primarily are looking at providing residential care. So when we look at old age people in old age homes, essentially, and you see sometimes carers who go in and live in with the with the people in terms of providing care. So this will be classed as, supporting them to helping them or the elderly in independent living. We are looking at obviously therapies, which sometimes patients need. For example, if they've had an accident or, they are recovering. So in those cases, you're looking at therapies. And obviously in the wider community, a lot of these people who work within the health and social care sector also work with youth, different types of community projects, and obviously their aim and main let's say area of work tends to be advice and guidance. And obviously one of the clear one of the main areas tends to be the early years of education, EYE as we call it, in terms of providing people with the tips to look at childcare and early years from a point of view of children growing up. They might also be providing help or assistance to single moms or single parents, and there are host of other services which people working within this sector provide to adults, children, the elderly, the families. It is to also look at mental health care right now, physical disabilities, learning disabilities, alcohol and drug dependency. So there are it's a very wide area, and obviously people working within the sector at some stage have lots of different choices of careers. We looked at one of the choice which Emma was talking about, and she wants to become a biomedical scientist, which is people working within the pathology lab, looking at doing tests or, looking at contributing towards the research and development of vaccines and the other things. So again, that's a very vast field itself. But when we look at this particular unit from a point of view of we studying in the level 3 diploma in health and social care, we are going to be focused on understanding the social care settings, which could be within care homes, community centers, it could be within health centers, it could be hospitals, it could be GP surgeries, it could be, say, for example, community healthcare centers. So when you look at the COVID vaccination, which has been done, the vaccination rollout typically, has happened with within the community with the support and help from a lot of different let's say setups. These included pharmacies, schools, hospitals, GP surgeries, care homes, residential care homes, and even healthcare centers, which were run under public-private partnerships. So some of them could be healthcare centers run by the NHS, and some of them were privately providing these services, obviously in close working relationship with the National Health Service. Now, when we look at going into the details of this particular unit, what I want to also do is show you the unit specification at this stage. And the unit specification will primarily help us narrow down on what we need to study at level 3. Now, this is a huge and a very vast field. So obviously there are over 150 different types of career options available. Some of you would be looking at going into nursing. Some of you would be looking at going into health and social care. But within health and social care, you'll be picking out careers or, looking at doing further, let's say, studies to complete your degree at some stage and then get into a career with the NHS or some sort of an organization related or working closely with the NHS. Now, here, our understanding, as you can see on your screen, is what is called the unit specification sheet. That is what we are going to follow. This particular unit, health and social care sector. So our main aim is to develop the understanding of what is the structure of health and social care sector in the UK. What is NHS? Where is the hospitals? Where are the trust, A&E department, the healthcare department, the health secretary? Where do they sit? What is the structure of health and social care sector in the UK? That is the first thing that we want to understand. The second thing that we want to understand is what key legislations and acts and regulations are important for this particular sector. How is this sector regulated? What are the key acts and legislations which have been passed over the years? And what is followed within the NHS and some of the related organizations to be able to provide service to the members of public? And then we'll also understand the importance of what is the, this is a unit that you guys will study probably in your level 4 and 5, and this will be a full unit at a later stage, which will be called working with multidisciplinary teams. Now, in health and social care, we need to be able to provide care, quality of care, and care which is tailored to the requirements of the patient. And this care, typically when it is provided from a point of view of looking at being bespoke to the patient, because you can't provide one type of care to all the patients. So here what we want to understand is when the care is provided, there are lots of different types of teams which are involved. And what we will do briefly in the last learning outcome will be to understand what is multidisciplinary working within the health and social care sector. Now, this unit is graded as the other units are in the course, pass, merit, and distinction. It's got 15 credits, and we are looking at covering this unit in about 4 sessions. So today's session is going to be more of introduction, and then we are going to look at looking at into a bit of detail going into learning outcome 1. Tomorrow's session is going to be learning outcome 2. Next week, same time, Monday and Tuesday, we will do learning outcome 3 first, and on Tuesday we will do the assignment discussion for this particular unit. So in this first learning outcome, we are going to be looking at understanding the structure of what is the structure, organogram, how is who comes after who, where is the department, who's the top boss, that kind of a structure within this particular first learning outcome. And it has 3 assessment criteria in the past, which first of all, it looks at overall structure of the sector. Then it talks about explain the role of health and social care regulators, who are the key bodies or agencies which basically regulate this particular sector. That is what we are going to understand. So bodies like CQC, the Princess Fund, the National Institute of Care and Excellence, the Healthcare Foundation. We look at some of these key bodies which are responsible for ensuring regulation and ensuring that everybody operates within a particular remit. So we will understand those. And the last bit being roles and responsibilities of staff working within the sector. Now here, what we need to be able to do is basically look at discussing different roles. The reason of showing this video at the start of the unit was to make you understand that what kind of careers, roles and responsibilities people can take up when they start working in a particular role. So here, the third part of the assessment criteria of learning outcome 1 will be to understand what are the different roles and what are the different career options available within this sector that people can choose to work with. And then we have to talk about these in a named organization. So we might not take the NHS because you'll have lots of different types of roles within the NHS, and it might be too exhaustive. But what we look at is take up an example of a care home, and in the care home we look at main sets of people which have responsibilities, and who are the set of people which work. So things like practice manager, healthcare assistant, healthcare professional, a GP, doctors who do locum. There will be administration staff. There will be people who will be providing therapy. There'll be physiotherapists available within the care home. There will be chefs, kitchen or dinner ladies. So what we'll have to do is look at one particular organization, and in that pick out the key roles of people within the health and social care sector. The merit criteria is going to be focused on discussing what is continued professional development. Why is CPD in short? If we see this particular sector, because of the fact that there is lots of changes, lots of new things which keep coming from time to time, and staff has to upgrade, reskill, and retrain to gain more skills to be able to provide the level of care which is required. We will understand the importance of CPD, career professional development, which is needed in order for you to not just get ahead in your career within this sector, but also to look at maintaining skills which are going to be at par and required for you to work, and also ensure that your service levels in terms of quality of care which is being provided are maintained, because that is a mandatory requirement which the employers need to ensure, so that everybody, all the staff, employees, people who work within this sector are trained, receive adequate training, and using that training, they are able to deliver the quality of care which is required to be delivered to the patient who are receiving that within any kind of setup in the NHS. And the distinction criteria talks about evaluating the structure of a named organization. So again, when we look at doing task 1.3 and we look at D1, what you do is use the same organization or a care home that we talk about. And in that care home, we will draw up the structure of the care home to show how the structure is. Like you have the director of the company, then you underneath have a practice manager, you have a registered manager who maintains compliances. So we'll talk about the structure and draw it up to crystallize our understanding of the first learning outcome, which is looking at the structure of health and social care sector in the UK. There is a fair amount of indicative content that we need to cover, and which is what we are going to cover in the first learning outcome when we discuss these assessment criteria, 3 on the pass, and 1 on merit and 1 on distinction. Now, let's look at switching you over to the presentation to discuss this particular learning outcome. And what we want to do is look at going through these in a bit more detail. So understand the structure of health and social care within the UK in particular. And as I mentioned, there are 3 main objectives of studying this unit. Understand the structure, legislation and codes which are required to be followed, and last but not the least, look at multidisciplinary working with regards to how the care is delivered within the National Health Service. Now, this particular chart is called an organogram that I've selected. Now, this is an organogram or an organizational structure chart, primarily of the Department of Health within England in specific, because obviously UK is 4 countries, devolved powers. So there are different national health services, and the structure might vary if you look at Scotland, Northern Ireland, and Wales. So for the purposes of discussion, we will look at the structure of National Health Service or the structure of health and social care in England. Now, if I have to talk about the structure, here, what we are looking at is, as you can see, the Department of Health. Does anybody know who's the health secretary right now? Anybody in terms of who is the health secretary? Okay, so when we talk about, somebody who is basically at the top, of the organization. When we look at the cabinet in general, we look at Steve Barclay, who's currently the Secretary of Health. Before that, it was, Nadeem Zahawi. And before that, it was Matt Hancock when we looked at the COVID pandemic. So when we talk about, the Secretary of Health, that's great. Thank you, Susan. It's Steve Barclay. So when we talk about somebody who is at the helm of the health and social care sector, somebody who's the boss in England, in specifically in the UK, if we talk about, Steve Barclay or Stephen Barclay. Now, under him, under the Department of Health, he's the person who heads that department. Under the Department of Health, when we talk about, there are lots of different types of, let's say, setup or organizations which provide this service. So under the Department of Health, you have the NHS England, the National Health Service of England. And the National Health Service of England has its own constitution, which is the NHS Act of 2010. Now, under the NHS Act, there are lots of different things which are defined. And obviously, the Department of Health, which is headed by Stephen Barclay, and before that was Sajid Javed. These guys in particular, when I look at the cabinet, they are responsible, the bureaucracy or the ministers are responsible for ensuring that they set the vision and the long-term, let's say, action which the department carries out. Now, in terms of structure, NHS England, NHS Act 2010, then we look at, three different types which are under the, setups within this organization. You have the clinical commissioning groups, CCGs, as we call them, and there are 209 of these. You have the sustainability and transformational partnership. There are 44 such setups, and then you have the health and well-being board. Now, along with the local authority, which is the councils, because when you pay your council tax bill, I don't know how many of you realize that when you pay your council tax bill, they also send you at the end of starting of the year, when they send you a council tax bill for the year, they send you a breakup of how your council tax is used. So when you look at your council tax and you look at your council tax bill, the breakup of that basically shows you, things where your money that you're paying to council tax is actually being invested. Now, in most cases, if you look at how your council tax bill and how your bill is being used, you would generally see that this particular bill that you get is appropriated into usage for schools, for hospitals, for fire service, for adult social care, for police and crime commissioner's office, and obviously the fire authority. So there are 4 or 5 elements of this council tax that you pay, and that is where it normally goes across to in terms of the money that you pay is attributed to towards the end of the year. So some part of it goes to the council, which is your local authority. Some part of it goes to adult care, adult social care. Some part of it goes to fire authority. Some part of it goes to police and crime related commissioner's office in your council. And then a majority of that part of that council tax that you pay also goes to the National Health Service. So when we look at national insurance, some part of it, if you recall, in the last year's budget, the government has now split the health and social care budget with, also levying a tax of 1.5 pence per, 100 pounds, which is now shown up in your salary or wage slips as the mental health care contribution, which the government is trying to set up, has set up already, and that is basically going to be looking at providing services through Mental Health Care Act, which has also been introduced. So the budgeting for that has been separated now from health and social care services into mental health care services. So for some of you, if you want to look at how the council tax bill is primarily say, for example, split up, and how your expenses or the money that you pay is primarily going to some of these services, I'll just briefly show you a glimpse of a council tax bill for you to understand. So as you can see, these are the broad heads in which your budget is the money that you spend or pay to the council actually goes in. So about 4.5% goes to police, 6.5%, 7% almost nearly goes to the fire authority. Your adult care, social care is 1%. Your council gets, the local authority or the council gets 2% of it. And then the rest of it goes to other services like hospitals, and obviously the contribution towards, the budgets for the National Health Service. It also goes to schools. Obviously, a lot of this split is not shown in the council tax bill. There is a addendum or an appendix which normally comes along with your bill when you get it for the year. There's a small booklet, and that basically shows the micro detailing of expenses. Now, looking at the structure here, broadly, coming back to the point, structure of the healthcare department, you have the Department of Health. Underneath that, you have 4 different bodies, which basically then divide or give further down into, provide further down services. And they include, your GP and other primary care services, which is GP surgery. You have the hospitals, you have private healthcare providers, which could be, private hospitals. Sometimes NHS does refer you to go and receive care from private hospitals. Things like Christie, Macmillan for cancer, and for other such services, it could be private providers working with the NHS or also receiving funding from the NHS to be able to deliver care, to the members of public. And then you have the social care provider or the social services which are provided, and this in general would form the structure of the NHS. Now, this structure has remained largely unchanged from 2013. This is another picture which basically shows how these services are a part of the Department of Health. And within that, you have all these services being provided, by various organizations or agencies which work under the Department of Health. So you have the Care Quality Commission. So here we also look at some of the key regulators that we will be talking about. We also talk about the Health and Social Care Authority. We also talk about, the MHEA, which is the Medical and Health Agency, which approves MHRA, which basically approves, medicines and healthcare products regulatory agency or authority, which approves all the, let's say the medicines, vaccines before they are, obviously administered to the members of the public. You will also have other professional regulatory bodies, which will be charity or set up as a social enterprise working with the NHS. And then you have the healthcare authority or the the NHS Act, and they will be a part and parcel of maintaining the regulation and codes of practices within this particular sector. So this is a chart which I've taken up from the Department of Health Governance website, .gov website. And this website basically drills down into, and it shows what are the kind of, let's say, different parties which are providing the delivery and provisioning of health and social care in the UK. They are classed into different types. And the key here, which basically gives, so the ones in the blue, they are the ones which are providing primary care. The ones in purple or violet are providing commissioning care. There is, improvement bodies or boards which are set up, which basically continuously look at making changes, studying the requirements from the members of public, and then look at making suggestions through different reports which are published from time to time in order to bring about changes into acts and legislation. You have community support groups, which are shown, obviously in the green, and then you have education and training providers, which are shown in pink. So there are local education and training boards, and there are healthcare education, which is a registered body in England, which basically looks at providing training to the staff and workers within the NHS. And then we have, safeguarding, which is an important aspect of ensuring that people, when they are receiving care, they feel confident that they are receiving the right amount of care and the due amount of care which is required for them to get back on their feet. And they're while providing the care, the people who are providing this care are not exploiting or exploiting them in terms of their vulnerabilities. And that is where safeguarding of patients and patients' interest and families comes in, and that has been shown as regulators in amber or in orange. So it's a very good way to understand the structure of the National Health Service in the UK. In particular, England, it does not vary drastically in other devolved nations like Scotland, Northern Ireland, and Wales, but the overall structure pretty much remains the same. And most of the main parts of the delivery of service, which tends to happen, is happening through GP surgeries, through hospitals and A&E departments, through private public partnerships or providers, when we look at, Bupa, for example, which is a private provider, you look at Spiral, you look at some of the hospitals which are set up as charities now, but they work in close partnership with the NHS, like a lot of cancer charities. You look at in particular, Christie's comes to your mind, which are basically going to provide this care in some cases to the members of public. And then you have the health and social care services, which primarily provide lots of different types of care, to members of public. And that is where we discussed, working with or within care homes, looking at working with schools, look at working with homeless shelters, healthcare centers, and, looking at supporting children, adults, people with disabilities. And this tends to be generally delivered through the social work done, social care services being provided within the community. Now, when we talk about the role of the Department of Health, we also need to understand what is their role. So the key, if you go on to the .gov's website and you look at what is the Department of Healthcare's role, what is the main role of the Secretary of State, Steve Barclay in this case. Now, when we talk about, his particular role, his main role primarily is to ensure that, the services required to be provided to the members of public are running, they are efficiently being run, they are productive, and they are delivering the results which the patients would require, and obviously, in this case, need. Now, most of it, when we talk about, again, related to, the 6 principles of person-centered approach, things like people working within this department, they need to be compassionate, they need to be able to respect and have the dignity and they are able to provide the dignity which patients, deserve. So the 6 values of person-centered care is something which is central to, people providing and understanding when they are working within this sector. And the Department of Health, basically looks at ensuring that when support, care, or treatment is provided, they are taking into account these 6 principles of person-centered care, and they are then understood by each and everyone which works within this organization. Now, the main priorities of, the Department of Health is to set the budget, to ensure that there is accountability in the system, and to also ensure, government targets on various, things in terms of, like, if I look at the COVID pandemic, the various targets which are set by the government and the COBRA meetings, which tend to happen to deal with the pandemic, are met. And the Department of Health and the Health Secretary in particular is ultimately responsible for ensuring that the whole system is working and is meeting the needs of the patient and is reflective of, the expectation and experiences which the patients expect from, a national health service. Now, there are lots and lots of different types of, regulatory bodies and acts that we need to also understand in terms of how they are rolling out and, providing these services. Now, when we talk about this particular slide that I've shown you is also showing you an overview of health and social care structures which are implemented as a part of the Healthcare Act, Health and Social Care Act in 2012. So if I look at national and if I look at local, so when I say local, what I mean by that is the structure and the authorities which are providing, this at the city level, at the town level. So when I talk about, local, what I mean by that is local authority. When I get this support in Manchester, within Manchester, there are lots of different hospitals, surgeries, dental care surgeries, lots of different setup. But where do I get it from? Where I live in and around in my place. So I need to look at that as a local, place from which I'm able to get and meet my GP or, go and see a registered nurse and get my medication and stuff. So if we look at that structure, which is in this slide, and then break it down into national and local level and go into a bit more detail, you have 3 types of services. One is public health, second is national health service, and the third is social care. Now, when we talk about delivery of these services, you generally see that these delivery of services are being currently done, by these 3 main let's say, bodies, or which are basically three pillars of the health and social care services. So you have NHS, Public Health England, and social care, adult social care. Now, within the NHS, you have the NHS Commissioning Board. You have a body which monitors the NHS functions. You have the NHS Development Authority, and you have the Care Quality Commission, which is a regulator. So this bit that we are going to cover is basically in task 1.2, which basically talks about what are the regulators and watchdogs, which basically ensure that the quality of service is delivered as per the desired guidelines and legislation which is set by the Department of Health in the UK. Now, underneath that, you have what is called the National Institute of Care and Excellence, NISCE. Now, this is one of the main bodies which basically looks at, so when we talk about, the National Institute of, this is also, we will go into a bit more detail, but when we talk about the National Institute of Health and Care Excellence, this is a body which primarily is a, public body under the Department of Health, and they are responsible for providing guidance, advice, and information on healthcare, public healthcare services and social care services, and how they are to be delivered, to the members of the public. So their role is primarily to look at, ensuring that evidence-based guidance is reflective of the, services which are provided by the members or the staff working within the sector. They are responsible for developing quality standards. They are responsible also for maintaining and ensuring that, performance metrics are met. So when we talk about, and I think this is something that most of us have heard or read about, is that currently the wait times in A&E department are in excess of 4 hours. Now, the government guidelines dictate that the wait time should not be more than 2 hours. So if the metrics are being measured, and if the guidelines in terms of the target are now being met, then it is the National Institute of Health and Care Excellence which is responsible for ensuring that what changes need to be done in order to ensure that the wait times are reduced or are meeting the levels which have been set by the Department of Health and Social Care. Now, they also provide a range of services in terms of information, advice, and guidance, and that is what is reflective of under them through a body which is called the Health and Social Care Information Center. And this particular center is responsible in close working with NICE, as I call it, and they provide a range of information services to various, when we talked about the PCCT groups, the surgeries, the GP surgeries, the private and public, partnership, which is created in terms of providing some of these services to the patient, and the local authority. So they are responsible for providing such information, to disseminate this information to the members of the public through local bodies. Now, an example that I would give you is when the COVID pandemic struck, the government did daily briefings, the Prime Minister ran daily briefings, and these daily briefings focused on, ensuring that how, one, an update on how the government was dealing with the pandemic, second, what measures were being introduced by the government to, control the pandemic, and third, how the government was looking at spreading this particular pandemic. So when we look at messagings which came out like space, face, and mask, these messages which were introduced by the Department of Health and Social Care, and their propagation down to the members of the public, and in terms of what and why a mask should be worn, and research to ensure that yes, the wearing of mask helps, saves the transmission or reduces the transmission of the virus, was being done by the National Institute of Care and Excellence. Now, this information was further passed on to the members of public at the national level, at the local level, and at the community level, using the dissemination of information being done by the Health and Social Care Information Center, or as we call it, the HIC. And they are bodies which basically you need to understand are at the national level. Now, once we look at, we have understood the main bodies at the national level, let's look at what are the bodies which are involved at the local level. So the Department of Health creates all the documents and rules and regulations and acts. And after that, it is down to, they provide this information, advice and guidance to then to be followed by local authorities and various, authorities in the local councils in cities and towns. Now, who are the bodies which are responsible for ensuring that this particular legislation, regulation, information is then read, understood, and then communicated to the members of the public? Number one, we look at local authorities. We look at CCG groups, clinical commissioning groups, which are basically running the hospitals, the setups from which most of the information is disseminated, or in some cases, most of the care, is provided when you need care from the hospitals. Then you have public healthcare providers, and then you have parts, bits and pieces of the health and social care boards and the local health networks, which are set up by the Department of Health at the community level. Now, it will also involve, working with the NHS, because if I look at an example of Manchester, there are, 2 or 3 hospitals under the under the CCGs. And when we look at these 2-3 hospital setups, Manchester Infirmary within Shaw, and you look at the Greater Manchester Northern General Hospital, they are responsible for providing all the care. When I say all the care, what I mean by that is if you need a surgery, if you have broken a bone, or if you're under the pandemic and you require immediate treatment, you need a ventilator, all of this will generally be done through the hospital. And that would be basically talking about, working with the local NHS or the setup which is there, and that would be required for you to get the primary care. Now, when I talk about, the clinical commissioning groups are basically, groups which were created under the NHS and the Health and Social Care Act of 2012. And their main aim is to organize the delivery of national health services. That means they are responsible for ensuring how do I get finally care from the NHS. Now, it's easy for me to make a statement that, okay, I get my, I get most of my medicines or care from the NHS. But how do you get it? Where do you get it from? What is the last mile from which you get this particular care? How do you know that this is a surgery that you need to go to, or this is the pharmacy that you need to get your medication from? If you order repeat medication, where is it to be ordered from? And in some cases, if I cannot get the treatment through medication, then I need to get be clinically operated or undergo surgery. Where would you go undergo surgery? What kind of checks would be done? All this organization and setup is primarily run and provided by, and planning of this is done by the Clinical Commissioning Group, or CCGs as we call it. Now, these CCGs are responsible for organizing the delivery of, as I mentioned, national healthcare services in your local areas. So if I know I go to this particular surgery, where does the surgery get reports to, and how does the surgery get the guidelines, information to be able to offer me advice? They are getting it from the Clinical Commissioning Group, which is in the Manchester area, or one of the groups which is based in the local area, and they are responsible for planning and ensuring that the delivery of these services happen and they are not abolished. That means the surgery cannot refuse the patient. And in this case, if you have to appeal, or if you have to, look at complaining, going about raising a complaint that, okay, I've not been provided this particular service, or I've been refused, then you would need to look at going to, the NHS, obviously, but within the NHS, the department which will be looking into this would be the planning department or the Clinical Commissioning Group. Now, they are an integral part because they are responsible for organizing these services, making sure that they are not abolished, and also at the same time, they are responsible for ensuring that integrated care services, or some sort of an integrated care system is created within a setup, within a region, and that allows then these services to be provided to the members of public. Now, one of the main things that we have to look at in terms of understanding this is to also understand some of the key acts and legislations which are responsible, when we talk about in general how these services are provided. Now, when we talk about the Health and Social Care Act of 2012, this is an act which was primarily created in order to do extensive reorganization of the structure of National Health Service. So if somebody is going to ask you a question, what is the Health and Social Care Act of 2012? You should be able to clearly answer that this is an act which basically looked at doing an extensive reorganization of the structure of the National Health Service in England. And this particular act is now basically the main act, under the NHS care. Let's put it this way: the main act, which basically is looking at the changes which are being introduced in terms of how the National Health Service provides care to the members of public. This looks at greater involvement from clinicians, the GPs, the NHS Commissioning Board, and also takes into account the patient voice. You and me in particular, if we are not happy with a particular service or we are not happy with the way things are moving, then it takes into account our voice to be able to put into a place a system which looks at improving the quality of care that we receive and ensures that regulators or the people who are working within this department and the setup is essentially regulated, and there are places from where there is sufficient, let's put it this way, let's say what I want to say is there's sufficient way for you to be able to go ahead and obviously discuss what are the various things that you are supposed to get and are not getting, and then you can look at making complaint or going to the right authorities to be able to get those things in place. Now, in order for you to understand this particular act, I have a handout which I've got from the .gov website, and this particular handout which I'll show you right now is a good handout for you to be able to read, which summarizes the Health and Social Care Act of 2012 and how this was responsible for the reorganization of the National Health Service within the UK. So it's a 2-page handout, which basically provides a bit of a synopsis for you to be able to understand what is the Health and Social Care Act of 2012. Now, with this bit, we are able to complete the first assessment criteria, and that basically talks about understanding the structure of health and social care sector in UK in particular. Any questions on this so far? If you have any questions on this, please feel free to ask me now before I go into the second assessment criteria. All right. If you think of any as we go along, feel free to ask me then, not a problem. Now, let's look at the second assessment criteria, which talks about the role of health and social care regulators and watchdog. Now, first and foremost, what we want to be able to look at is understand that, who are the key, let's say, bodies. One second, let me just quickly respond to one of the learners. So when we look at the key bodies which regulate the quality of care, the service of care which is being provided, the service levels which are being maintained and provided, and regulation which everybody, everybody in this particular sector has to follow. Now, there are key organizations. What do we mean by regulation? Regulation is a major part which basically has to be done within this sector because of the fact that there are lots of different types of bodies which work within this sector, and because it is responsible for providing care, what we need to be able to ensure is that there are certain amount of rules and a code which everybody adheres to in providing this and delivering this care to the members of the public. Now, the process of the action through which this code is followed, and this code is then propagated down to various bodies, channels from which the service is being provided, will be under what is called regulation. Now, there are a couple of bodies which are responsible for regulators, in regulation, or let's say are watchdogs or regulators, in the care sector. So when we talk about regulators in the health and social care sector, we talk about one of the major bodies, which is called the Care Quality Commission, or CQC. Now, CQC is basically the signature body, which is basically responsible for ensuring that the members of public are protected and they are not put to risk or receive any harm when they are receiving the health and social care services from a provider within this particular sector, whether it's the NHS, whether it's a private provider or a public provider or a partnership which is providing these services under the banner or the remit of National Health Service. And this particular body looks at carrying out regular inspections, and these inspections are quite thorough. They look at understanding and inspecting the body from a point of view of premises. There are five various points to the CQC inspection framework, and this CQC inspection framework, when we talk about, basically looks at their guidance from a point of view of ensuring that the care homes, hospitals, dental care services, clinics, services which are provided at home, GP surgeries, mental health care being provided, or any sort of care being provided within the community by community support groups, all are conforming to the standards which are set in order to deliver the basic care services to the members of public. Now, if I say we need to go about understanding who is CQC, what they regulate, and why they are important, is the government actually set them up as an independent regulator of health and adult social care services in England. They are a body which is not under the control of the government, but was set up by the government essentially to ensure that health and social care services provided to people are safe, they are effective, staff working within this sector is compassionate, and they are trained to be able to provide high quality care in order to ensure that patients get well soon and get back on their feet. Now, their main aim is to monitor, inspect, and regulate the services being delivered in this sector. And what they do at the end of it, when they do inspections, they publish these reports. And in some cases, if they find that the services are not being provided to the expected level or the desired level, which have been prescribed, by the Department of Health or by the, let's say, the Health and Social Care Act 2012, then in those cases, this particular body can also create sanctions, put sanctions, revoke the license in most cases, and in a severe case, or in extreme cases, can also bring across criminal proceedings against, the employers or the providers which are providing this care to the members of public. Now, there is a handout which I'm going to also share with you, which is basically a handout on CQC, and that Care Quality Commission handout essentially would be, I would say, useful for you, because it will give you a good sense of what, the CQC is. And this is something that will be available, from a Moodle after this session. Now, this particular handout, very briefly just showing it to you, is going to be a 10-minute read. And this particular handout will give you a very good understanding of what Quality Care Commission is, what do they do, how do they do, and what are the key functions they perform in ensuring that these services and the quality of services maintained within this sector. Now, it is also important for you to understand and read this handout, because this is one of the bodies that you will be coming across quite often, and reference to this body will be made quite often, and it will be useful for you to have a very good understanding of what the body does, who they are, how they inspect, what they regulate, and what are the 5 key questions they ask in all the inspections that they do, in order to ensure that the setup, whether it's a care home, hospital, a GP surgery, or any other such setup in the health and social care sector, is working and providing services as per the code which has been defined by the Department of Health. Now, there are lots of other bodies that we also need to be aware of, which are termed as regulators, and there are 12 such other bodies which are on the slide. So you have the General Chiropractic Council, GCC, This regulates chiropractors. There are, I don't know in terms of do you know who is a chiropractor or what does the chiropractor do? So chiropractors are essentially people who treat nervous system and musculoskeletal disorders. They are basically doctors who take care of any kind of muscle, bone, joint dysfunction. So there are lots of different councils which have been set up, and they are regulators within this sector. We have heard about things like the GMC, General Medical Practitioners Council, which is the Doctors Council. You heard about maybe the General Dental Council, the Nursing Midwifery Council, NMC. These are the ones that we get to hear more often in the news because of various reasons in terms of dealing with the pandemic and stuff. But there are lots of other, regulators in this sector which we need to be aware of, and they are listed down on some of these slides. So you have the General Dental Council, General Medical Council, which is for doctors, General Optical Council, which is primarily for optometrists, people who look at eye-related, surgery, and let's say, people who work within the, one such example that I'll give you is if you go to Specsavers or any such sort of an outlet wherein you're getting your eyes tested, they will be covered under what is called the General Optical Council. You have the Osteopathic Council. You have Health and Social Care Practitioners, HCPC. Now, some of you, after which you complete this course, or if you go on and do another course and study under the Health and Social Care Management, at some stage when you complete your degree and you want to become a member of the HCPC, you would need to apply to them to get a membership. And this membership will essentially allow you to work as a registered health and social care professional in the UK. And I think across the world, because the HCPC Council is recognized more or less globally. And just like in other areas, like you have Chartered Institute of Marketing, you have nursing, you have dentistry, you have doctors, this particular membership would, becoming a member of this particular body, the HCPC in particular, will allow you to work and offer your services as a health and social care professional, globally. Bodies like Nursing Midwifery Council, as I mentioned, General Pharmaceutical Council. You have other areas like Pharmaceutical Society of Northern Ireland, PSNI. You have Northern Ireland Social Care Council, NISCC. You have Social Care Wales. You have Scottish Social Care Council, SSC. These are other regulatory bodies which are responsible for providing, they are kind of watchdogs, and they're responsible primarily for ensuring that setups, or let's say, when I say setups, I mean setups by, what I mean by setup is care homes, dental surgeries, GP surgeries are all abiding by the code of conduct and the law which has been laid down in order to deliver the quality of care and standardized services to the members of the public. Now, when we talk about regulation and monitoring, these are different councils, and what I've done is in this slide just briefly elaborated on some of the main areas and functions that the regulatory bodies do. So if I just talk about, say, for example, GMC, which is the General Medical Council here, it says there are 260,000 registered GPs or members of this particular council. This act was created in 1958. This particular council regulates and sets the standards required for doctors practicing in the UK. So when you look at PLAB 1 and PLAB 2 test, people who have medicine or a degree in medicine but want to come to the UK and practice medicine in the UK, they have to undergo certain tests to be able to ensure that they are meeting the guidelines and the required standards to be able to operate and offer their services as doctors within the UK. They undergo what is called the PLAB 1 and PLAB 2 test. Now, this council basically regulates those standards, and it is responsible for ensuring that all doctors which are privately practicing are then following these standards in order to deliver services to their patient. So an idea would be to try and not go into a lot of detail, because the task here talks about explain the role. So what you could do is, using this slide, maybe talk about 2 or 3 of the regulatory bodies like Quality Care Commission, which is the CQC, for which you'll have a handout. You can summarize that in your own words and obviously write maybe 75 to 100 words to explain what the CQC does, maybe one or two other bodies like GMC or Nursing and Midwifery Council, and that would be good enough for you to understand and cover this task. So here the idea is to look at, basically talking about bodies which are involved in regulating, or when I say regulating, what I mean by that is setting the rules and regulations which are required to be able to offer these services with due care to the members of publics within this particular sector. So that helps us cover assessment criteria 1.2. Any questions on this so far? Okay, let's go across to the third assessment criteria. Jefferson, any questions at your end? You look a bit confused.
No, I'm all right.
All right, okay, great.
Yeah.
So let's go to the third assessment criteria, which is talking about explain the roles and responsibilities of staff working within this sector. Now, as I mentioned to you earlier, and in the first video which I shown, there are lots of different types of people and careers which are possible within this sector. So people can, work in areas like advice and guidance, childcare, early years, child protection, looking at community work, counseling, fostering and adoption. You look at housing, social housing, occupational therapy. We talk about psychology. We talk about residential care. We talk about providing support for elderly to be able to do independent living and other things which are related to therapies. They can all be, various kind of roles and responsibilities within this sector. Now, what we have to do is, if you read the task, and what we need to do is, we don't want to generically understand, but it talks about a named health and social care organization. So for those of you who are in work and have worked or at some point in time volunteered or worked within a health and social care home or any type of a setup, then what you have to do is, I would ask you to here now to wear that thinking hat and say, okay, I was working in one of the care homes in Blakely, for example, the Blakely care home. And when I look at that, what were the key people working within that care home? And then think about the roles and responsibilities, of the people working within that care home. So when we talk about such, tasks wherein we have to understand the roles and responsibilities, we need to be able to look at a particular care home, and within that care home, look at what could be the various people working. And with those in mind, we need to look at, talking about the roles and responsibilities which these people would have while working within the care home. So if I now talk about, if I do a quick search, for example, of care homes in Manchester, the first one that comes to, on the search on Google is Abney Court Care Home in Cheadle. Now, this one, for example, is a care home which provides, let's say, services to elderly. And in terms of the services it provides, there is, lots of different types of services. So what I would want to do is look at what could be the various types of people working within this care home. And when I look at going onto the website and basically see the About Us section of the care home, that is where we basically look at understanding what kind of care does the care home provides. Now, this care home provides residential care, care for patients who have dementia, and they also provide care towards the end of life for older people which are living in that area. Now, what we want to be able to do is understand. So what I've done is, from the website itself, I've been able to just briefly look in and find out what kind of care they provide, what kind of CQC rating they have had, and how long the CQC rating is good, and how long has this been going, and what areas in which they provide the service. Now, within this, what I want to do is find out because I know now there are three types of services which it provides. Residential care, that means people who are old and they are going to, receive care, which could be care like bathing, food, looking after independent decision making, and end of life care and care for patients who are having dementia as a degenerative disease, for example, wherein dementia is primarily when people start, it affects your brain essentially. And in this case, when we look at patients with dementia, they basically suffer from loss of their cognitive abilities, including memory and concentration. So shaking of hand, for example, forgetting, and various types could also be there, things like Alzheimer's and Parkinson's, and they would be basically people who would require some sort of care. Now, when I think of that and I think of this care home, I need to look at what are the people which will work within this care home. So when I look at that, I would generally, on the slide I've discussed, a couple of different types of roles and responsibilities, but within, say, for example, if you were to take a care home in your area, depending on the services it provides, you might want to look at what would be the roles and responsibilities of people working within that care home. So one such service that the care home would have or people would be having is social services. There would be a healthcare visitor, there would be a GP, there would be, in some cases, therapy or therapists, nurses, and healthcare assistant. So if I was to, say, for example, talk about in a particular context of, let's say, ATHE care home, and the people working within this care home, I would look at first social services. So let's start with the first. I would look at health care assistant. I would then look at health care professional. I would look at nurses. I would look at a doctor or a GP. I would also look at a nurse. So in this case, say, for example, mental health care nurse. Mental health care nurse. I would also look at people who provide occupational therapy. And there could be other, people that I would say would work within the care home, which could be administrators. It could be the practice or the registered manager who is responsible for, ensuring standards as per CQC. There would be dinner ladies, because obviously food and kitchen facilities would be provided. There would be social care workers, which are coming in social services, essentially, so social care workers. So you could have maybe 10, 15 different types of people working within, this particular care home. There could be some suppliers and contractors. But what I would want to do is, don't want to look at, because again, the task here is explained. So what we need to be able to understand is, how do we look at a care home or a setup within the health and social care as an organization, as a named organization? And within the named organization, look at the type of people working and providing services to patient, and then be able to talk about their roles, essentially, as far as this task is concerned. So what I've done in the subsequent slides is, when I talk about social services, what do you mean by social services? Social services would be provided typically by the council, wherein you'll have childminders, people who are responsible and, for example, fostering, relationship for children, particularly for children, they would be providing these services. And what I've listed down here is, in individual slides, some of their roles and responsibilities. So when I look at GPs, what is their role and responsibilities? So you go and see a GP, they prescribe you medication, they look at, obviously, having conversations with you to diagnose what could be the problem, the disease, or if it requires urgent attention, that they would now then need to refer you to a consultant or a hospital wherein you go and get further scans and tests done. And these are the bits that you would need to cover in some of the roles and responsibilities. So here, what I would expect you to do is choose a care home or a setup of by doing your own research on Google, find out what services that setup provides, And within those service, on the basis of that service the setup provides, think about the roles and responsibilities which the people would have, and then talk about 4 or 5 to be able to cover this task. So I have covered a few by looking at GP services and social GPs and social services, but you would need to add a couple more in your named organization or your chosen organization, chosen name organization, to be able to complete this particular task. Is that okay? Any
Yes.
questions?
Yeah, this is okay.
Okay, good stuff. Let's go to the merit criteria, which is talking about explaining continuous professional development and why is it needed as far as the health and social care is concerned. Now, CPD, as it is also called, continuous professional development, CPD. Now, CPD is very important because it is a term which is used to describe activities that you learn to engage and enhance your professional skills when you are working, within a particular setup in the health and social care sector. So this particular bit that we talk about, in terms of CPD activities and why is it important within health and social care is of relevance here, is because CPD is a process of developing professional skills, which can be done through knowledge based activities. It can be done and gained through experience. It can also be done through on-job training or apprenticeships, as we call it. So in some cases, what tends to happen is that when we look at gaining new skills, so for example, if you join as a healthcare assistant, or if you join a new setup and there is a new machine which has been introduced to take blood pressure, and you're a healthcare assistant, or you're working as a nurse, so you should be able to understand how to operate that particular machine. So there'll be some basic training which will be provided by the employer, and that training will become a part and parcel of your professional development, because then you'll be able to use that machine confidently to be able to take readings of blood pressure. You understand what is low blood pressure, high blood pressure, hypertension, or you understand what is systolic and diastolic blood pressure, and those bits would be required for you to gain knowledge on, to be able to then offer these services should you need to do so for a particular patient. Now, learning can be of very different types. They can be self-managed learning, it could be knowledge-based learning, it could be learning which is led by your employer or at your place of work, and that is where learning is very important as far as the this particular working within this particular sector is concerned. The reason I say this is because when we work as nurses, healthcare professionals, or any sort of role that we take up within the sector, there are lots of trainings that you undergo, and these trainings are basically done to ensure that you have professional capabilities and your skills that you have or do not have are required to be able to give and provide the quality of care to the patients. Now, why is it important in this sector? Is because for example, in this sector, there are lots of different types of things which come up on a daily basis. So when I look at doing understanding on why CPD is important, a lot of nurses, for example, were asked to, or healthcare professionals were asked to do a quick bit of training on, say, for example, during the COVID pandemic. And this was primarily done with the frontline staff so that they could effectively and safely deal with the COVID-19 virus, so that transmissions could have been minimized. And this required practitioners having the knowledge and the skills, being able to then use the personal protective equipment, PPE, wear a face mask. They were aware of some of these things that are required to be used in order to ensure that they would still continue to provide these services, but at the same time also be safe and keep themselves safe and reduce or do not, contract the virus while providing these services. So when we talk about CPD in general, we talk about CPD because of the fact that in the health and social care sector, this is something, which is required to reskill, upskill, learn, and also grow within your career by acquiring new skills over a point in time. Now, practitioners, people who work within the sector, are called practitioners. Practitioners need to update their knowledge and skills regularly to match the changing complexity of requirements in the health and social care sector. Now, this can only be done through trainings. This can be done through acquiring knowledge. This can be done through by, getting into and doing apprenticeships or essentially observing someone. Sometimes when you join a new role or you get a new job or a responsibility, you're asked to observe and work with a particular professional who's handing over their roles and responsibilities to you, and they do so in a practical way. And that is where you're working, observing, and also taking over from them practically to understand how things are being done and how they are being delivered. And that is why it is important. Now, this is a chart which I'm showing, which has been taken from the from an NCFE website. And the reason I've used this chart here, trying to expand so that you're able to see, the reason I've used this chart here is it basically shows career progression. Because not to forget that when we talk about CPD, we have to talk it in the context of progression within the health and social care sector. So this particular chart actually shows what type of training you need to receive to work within what particular role. Now, if you are looking at working as a nurse who is working with dementia patients, then you would need to have training in that particular sector to be able to, let's say, work confidently by receiving trainings which are related to dementia. So when we talk about trainings, in dementia, a nurse, which is basically, providing care to patients being diagnosed with dementia, would need to look at some sort of basic trainings which give them knowledge and understanding of what is dementia, how to provide care, what kind of, various, let's say, conditions they need to be aware of. And in some cases, they'll be asked to do a training on Alzheimer's disease. They'll be asked to do a training on dementia care. They will be asked to do training on dementia awareness, for example. And it would include, things which is to understand, how this condition develops, what kind of, deterioration this condition will have with patient. And in those cases, how would you go about providing or adjusting care which is required so that the patients are comforted and obviously also receiving, this care from a point of view of, let's say, helping them do their daily individual functions. Now, when you look at this particular chart, it also explains other career progression pathways for nurses, for healthcare assistant, for healthcare professionals, for people working in the early years, and also with people who are working within fostering, and adult care and adoption, and also looking at, people who are providing residential care. There are lots of various career options which are discussed, and also various courses which you would need to do in order to have, knowledge, and obviously gain these skills as you, grow in this particular career. Now, there are 2 or 3 good sites which I would expect you to read. One is the importance of CPD, which the NHS actually places, on, let's say, their staff, and why is CPD a part of the NHS constitution. So when we talk about this, there is a link which I've put on the site, and this link basically tells you about why the NHS places so much emphasis and investment is done primarily through the one of the bodies that we read, the Health and Social Care Information Center, which basically looks at providing these trainings to the members or practitioners which work within this sector. And that is given on this particular, nhs.gov, website. And this website would give you a bit of an understanding when you do a bit of reading on what is CPD, why is CPD important within the National Health Service, and what kind of trainings and career options would the professionals get if they get into and do and complete these trainings, and how does it help provide the right quality of care to the patients when they receive these services from members of staff working within the National Health Service. And in general, two other articles which basically would help you understand that some of these regulatory bodies that we studied earlier and looked at, like the Nursing and Midwifery Council, you look at the GMC, they have, in order for you to continue their membership and continue to claim that you're a member of this council, you have to maintain certain standards of skills and care that you provide, basically skills that you need to have. And for that, some of these bodies place, in some cases, some requirements on the minimum number of training hours that you have to put across the year in order for you to continue to have the membership of the particular body. So the Nursing and Midwifery Council, for example, expects that all nurses complete at least a minimum 35 hours of training, across the year to be able to continue their membership with the NMC. And this is something which is, as a requirement there for most chartered bodies which provide you the membership. So, for example, if I look at Chartered Institute of Marketing, you look at Chartered Institute of Professional Development, you look at Chartered Institute of Surveyors, you look at accountants, there are certain bodies and regulators within each, in various sectors, let me not say each sector, but certainly different sectors, which expect you to do a certain amount of training across the year in order to keep your skills up to date, so that you are able to perform your duties to the best possible abilities. And in this sector, obviously, with healthcare professionals, that you're able to deliver, use your skills and the trainings that you've received to be able to deliver services which are meeting the standards of CQC in terms of quality of care. Now, we also do CPDs. As students, we do a lot of CPD or career trainings that we need to do. And this can be emphasized from a fact that in our case, as a learner, this will be called the Personal Development Plan, or PDP, personal trainings that you do. For example, if you're looking at writing how to write an assignment, or if you're learning how to reference your work using Harvard referencing, then these are personal trainings that you're doing in order to improve your capabilities and skills, and they would be classed as PDP or personal development. But in the case of career development, these are opportunities or trainings or skills that you actually get by attending trainings, seminars, or by doing self-managed learning to be able to work effectively at your place of work and then deliver those services. And they would be termed as what are called CPD, because they're related to your career, not your personal attributes. And that is why they are called the CPDs. Now, this will help us cover the criteria, which is primarily 1.1M1, which is talking about how do we look at what is career professional development or continuous professional development, CPD? How do we look at this for progressing further in the careers within the health and social care sector? And what I've done is I've defined certain ways through which this career progression can be done by attending training programs, by appraisals and reviews, by looking at attending conferences or trainings that are important and relevant to your job description, looking at self-managed learning that you would do through e-learning, and also informal learning, which could happen by budding up with somebody in the organization, by observing somebody, by gaining experience, by doing a qualification. And they would all come under different forms of learnings that you would do in order to, look at your career professional development. Now, any questions on this so far? Any questions on the merit task? So here, you're talking about what is CPD and how would you look at career professional development if you were a healthcare professional, and you have to list out at least one or two such opportunities that you would look at through which you would be able to upskill, reskill, and look at moving ahead in your career in the health and social care sector. Now, the last task is the distinction task, which talks about evaluating the structure of a named organization in health and social care sector. So here, like I've taken the example of Abney Care Home, what I would suggest is that you take up the example of, not the example, I would say I am not going to ask you to take the example of NHS. The reason being, this is going to be too wide and too big, right? So what I would suggest is, I would suggest a local organization that you can research through the website can look at in your area, or if you have worked previously with them, take that organization as the named organization. And with that named organization in mind, what you need to be able to do is draw up their organization structure. And that is where I would expect this task to be completed. Now, just for the sake of the reason I've changed this slightly right now is that just for the sake of understanding, because in the previous past, this particular task has become too difficult for people to do, because if you look at the NHS, it becomes too big a topic and too wide a topic. There are so many things to look at. So I would suggest, for the purposes of this task, to look at a smaller organization. But for a general understanding, when we look at evaluation, what we need to look at in the evaluation would be to look at covering some of these things, within that organization. So things like, what was the initial structure when it started? So if it was a care home, it started initially, there must have been 3-4 different people, and it's a small structure. But over the years, as the care home is expanded or the organization expanded, the structure has also grown. What has happened, say, for example, in the organization, if you look at when it started and now, if it has been 3 years or 5 years or 10 years, then you need to look at presenting some sort of a picture that how has the structure changed. And then we talk about what are the services this particular organization is providing. And that is what you list out by breaking it down into these 3-4 different questions. So in the case of NHS, just to give you an understanding and how you would cover this, I have actually done and explained this task by looking at the initial structure of the NHS when it started in the 1950s, late 1950s, after the World War II. The government came up with the plan to set up the National Health Service, how things have changed over the years, and how the structure has changed over the years with the constitution of NHS being created, the NHS Act in 2010 being created, then the Health and Social Care Act reforming and making the practitioners accountable in this particular sector. And these are the major set of changes which have happened in the NHS, and they need to be looked at, documented from a point of view of evaluation. And this is what I've actually listed down on the, example. So when you look at doing this particular distinction task, I would suggest choose a smaller organization that you're aware of, and then look at talking about the structure of the organization and how it has changed over the years to provide more effective services to the members of the public. Now, for this, I would suggest you could take up an organization like a care home. If you're happy taking and you want to do a bit of detailed research into understanding the National Health Service, I would suggest taking a bigger organization. If you want to do we all talk about the National Health Service, NHS, but there are lots of other big providers in the UK which provide private medical care, and there could be organizations like Bupa. You could also pick up a GP surgery, because that is something that you're familiar with. You go across to your surgery, you see the organization chart, who all are the members in the surgery. You have the practice manager, you have the registered nurse, you have the clinical nurse, you have 1 or 2 healthcare assistants, you have people at the reception, you have essentially GPs or consultants or locum doctors which do locum over the weekend. And that gives you a very good idea in terms of the structure of the organization that you can talk about. And the main part being, you have to do this task with a name in mind. You can't just do this task generically by saying, okay, I'm describing the structure for this or describing the structure for that organization. You have to do this as a named organization in order to achieve distinction. Now, in the backup slides, which I'm going to upload, you will also see some of the other roles that I had mentioned, which you could read about when we talk about the health and social care sector. This was related to, task 1.3, in which we wanted to talk about the named organization and the type of people which work and the role they carry out. So what I've done is we discussed only 1 or 2 different types of roles, like the social care services and the GPs. But if you want to read about other roles, when you go down to the end of the presentation, I've also put down the key roles of psychologists, hospital services, pediatricians, midwives and healthcare visitors, mental health care services, educational services, police, a charity like NSPCC, and there are other such organizations which are involved, at the Child Protection Agency. So I have discussed and put, lots of different types of roles, but that does not mean that all of these roles you would need to carry, but this is maybe for your reading and understanding that in terms of when we talk about a named social, health and social care organization, depending on the type of organization you choose, you need to be able to talk about the roles and responsibilities which are there with people working within the organization. And a lot of these I've listed down as backup slides towards the end of the presentation. So with this, we come to an end of the first learning outcome discussion that we have done today. And this would essentially cover, the understanding of the structure of the national health, structure of the health and social care sector. Within that, the National Health Service, the key regulators and watchdogs, which are organizations responsible for ensuring rules and regulations and the codes of conduct in the delivery of care to the members of public or patients. And then what roles and responsibilities of people working within a named organization, its evaluation, and the need for career professional development in order to look at carving out a career or developing your career within this particular sector. So any questions on today's session? Any questions? Feel free to ask. All right, so I've got one, Susan, which will reply, no questions. Thank you for that, Susan. Anybody else, any questions that you have in mind? Okay, if there are no more questions at this stage, that's absolutely okay. What we can do is I'm going to basically upload these handouts and the presentation, the CQC handout, the Health and Social Care Act 2012 handout, and the handout primarily on the CPD side of things, which is an article which I would want you to read, just briefly showing that to you on the site now. And that would allow you to crystallize your understanding on the three main concepts like CPD, the regulators, and also the NHS and the Health and Social Care Act. So this article will be a good 10 to 15 minute read to understand what is CPD, why is it required, and how do nurses, for example, take on career professional development within this particular sector. So this article would essentially help clear some of the reasons behind why career professional development and training and self-managed learning is important for people working within the National Health Service in particular. So thank you so much for joining, and I will see you tomorrow, same time at 11, and then we'll continue our journey into learning outcome 2 for this unit. Thank you, and bye for now.
Thank you.
Thank you.
Thank you.
Bye.